So now let's look at a list of bugs that can infect unimmunized children. As far as the step 1 is concerned, you should only suspect these sorts of infections if the question states that the child is from another country or has specifically not received immunizations. However, in the real world, you cannot assume that any child is vaccinated. In some parts of the country, experts estimate that upwards of 25 to even 33% of children are unvaccinated. Unvaccinated children are at higher risk for a number of serious diseases, including infections that can cause rash and pharyngitis, and more seriously, meningitis and epiglottitis. Let's see if we can fill out some of this information. Do you remember the 2 important pathogens that can cause rashes and are protected by one of our most important pediatric vaccines? Rubella and measles virus typically can cause a rash if infected, but the MMR vaccine is protective against these infections. Now, can you tell me what kind of vaccine the MMR vaccine is? Is it killed, subunit, or live? The MMR is a live, attenuated vaccine. Now, thinking back to measles, do you remember the important prodrome or preceding symptoms that are commonly seen in a measles infection? Remember the 4 C's, or cough, coryza, or a head cold, conjunctivitis, and Koplik spots. You can imagine a C here instead of the K to help keep the mnemonic intact as the 4 C's. Corynebacterium diphtheria is a bacterium that causes pharyngitis and is protected by one of the important vaccines. Do you remember which vaccine protects against diphtheria? That would be the DTaP vaccine. DTaP protects against diphtheria, tetanus, and pertussis. Do you remember what the characteristic finding in a patient with diphtheria pharyngitis would be? You would see pseudomembrane formation and inflammation that could be so severe that it could obstruct the airway. Now, can you think of some pathogens that might cause meningitis that otherwise would be protected by vaccines? Haemophilus influenza type B and poliovirus are both common causes or causes of meningitis that have an effective vaccine. And what cell type would you see in the cerebrospinal fluid of a patient with polio meningitis? Let's think back to our CSF findings. We would see lymphocytes in the CSF in a patient with viral meningitis. And what about this bacterial meningitis? What would we see on CSF analysis? We would see the presence of neutrophils or PMNs. Very good. And finally, epiglottitis can be caused by Haemophilus influenza type B, which is protected against by the new Hib vaccine. Epiglottitis manifests with dysphagia and drooling, very key to findings. In fact, it can get so severe that the patient can have difficulty breathing due to the inflamed epiglottis. It's important to remember that epiglottitis is a surgical emergency. This final page of the system section of First Aid Microbiology is a helpful one for your test. It is simply a list of high-yield associations. I'm going to use this more or less as a quiz section where I ask you to help me fill out this chart. Hopefully this exercise will help identify some of your weaknesses and places you may need to review. So let's go ahead and start. What do you think of when you see an asplenic patient? Well, first, instead of just memorizing, let's think. What is the spleen important for? So if my patient doesn't have a spleen, what should I be thinking about or concerned about? Well, remember, the spleen is important for antigen, antibody, complex processing. It helps process these complexes. So it is very important for dealing with encapsulated organisms. Do you remember the 3 most important encapsulated organisms? That would be Strep pneumoniae, Haemophilus influenza type B, and Neisseria meningitidis. This is extremely important and high yield for your step 1 exam and beyond. Any patient who has a spleen removed should be carefully monitored for any infection with strep pneumo Haemophilus influenza, and Neisseria meningitidis. It's also important to remember that they should be up to date on their vaccinations for strep pneumo and Haemophilus influenza. Next, what do you think of if the question mentions sulfur granules with branching rods in an oral infection? You should definitely be thinking about Actinomyces israelii. Remember, Israel has yellow sand. And how do we treat actinomyces? With penicillin. Very good. So next, what organisms are you thinking about when the question mentions a patient that has chronic granulomatous disease? Let's think about the disease for just a moment. These patients lack which enzyme? They lack NADPH oxidase, and therefore they cannot produce superoxide radicals. Very good. So what organisms are these patients predisposed to? These patients are predisposed to infections with catalase-positive microbes. There are a number of different microbes that are catalase-positive, most importantly including Staph aureus, Serratia, Pseudomonas, Listeria, Candida, E. coli, and Aspergillus. Staph aureus and Aspergillus are the most common catalase-positive organisms. You can remember these organisms with the mnemonic places. P stands for Pseudomonas, L stands for Listeria, A. Aspergillus, C. Candida, E. coli, S. Staph aureus, and the other S. Serratia. Very good. Now if the question stem happens to say currant jelly sputum, what are you thinking about? You should be thinking about Klebsiella. Very good. And how about patients are bit by a dog or a cat? You should be thinking about Pasteurella. Now, if a patient has been found to have a cranial nerve 7 palsy or a Bell's palsy, what disease are you thinking about? You should be thinking about an infection with Borrelia burgdorferi causing Lyme disease. The mnemonic used in Lyme disease is bake, and you can bake a key lime pie, which will remind you that Bell's palsy that causes an arthritis, a cardiac block, and erythema migrans. Very good. Now, what kind of fungal infection would you see in a patient with diabetes or if they're severely immunocompromised? If you ever see a fungal infection in diabetes, you should be thinking about Mucor or Rhizopus species. Continuing on, what infections would a healthcare provider be at risk for? They would be at risk for needle stick injuries, and what are we thinking about with this? We'd be worried about hepatitis B virus infection, among other different viral infections, but hepatitis B being the most high yield. What about a neutropenic patient? What infections are you worried about with this type of patient? We're worried about fungal infections, including Candida and Aspergillus. Haemophilus influenza is a common cause of pediatric infections. In pneumonia with cystic fibrosis or a burn, what would you think about in terms of organism for this patient? We'd want to be thinking about Pseudomonas. Very good. Pseudomonas is commonly associated in patients with cystic fibrosis causing a pneumonia, and it can also cause or be bad infection in patients with bad burns. Do you remember which penicillin we would use against Pseudomonas? We would use piperacillin. Piperacillin or ticarcillin. Do you remember which beta-lactamase inhibitor is commonly given with ticarcillin? That would be tazobactam. And this combination is called Zosyn. What bacteria do you think of if they were to have PAS positive on pathology? You would be thinking about Trophorima whipplei, which causes Whipple's disease. Do you remember the triad of symptoms that is seen in Whipple's disease? Remember, this is a malabsorptive disease that causes diarrhea and weight loss. We can remember its symptoms with the CAN mnemonic, CAN, since it's associated with cardiac symptoms, arthralgia, and neurologic symptoms, and also causes that diarrhea and weight loss. Do you remember what patients are commonly infected with Trophorima whipplei? It's commonly seen in older men. Very good. The most common causes of pus empyema and or skin abscesses is Staph aureus. There are only 3 things that can cause rash on the palms of the hands and feet, and what are those? Coxsackie A, Treponema pallidum, or Rickettsia rickettsii, and Rocky Mountain spotted fever are the 3 things, or the only 3 organisms that can cause rash on the hands and feet. So this is an important clue to help you narrow down these 3 organisms. So sepsis and meningitis can be caused by group B strep in babies, and if you were to see this, you would be very worried about serious sepsis or meningitis. Patients with surgical wounds are susceptible to Staph aureus infection, and people with a traumatic open wound are susceptible to Clostridium perfringens, which can cause gas gangrene, which is seen clinically as crepitus or air under the skin. So now time for a final flash quiz. For which bacteria is a patient on mechanical ventilation most at risk for? These patients are at risk for Pseudomonas pneumonia. Remember that Pseudomonas is a water-loving bacteria that has a special affinity for mechanical ventilators and nebulizers. The bacteria is able to use the ventilator as an avenue into a patient's lung and can cause very serious pneumonia. And that's all for the systems microbiology, guys and girls. Now let's move on to some test yourself questions so you can practice and apply what we've gone over in this last section.